Health Systems Collaborative, and we would like to give you an introduction to human-centered design and user experience, and how that can be used or maybe even should be used in health systems research. And yes, it will be Gulraj talking mainly about human-centered design. I talk about user experience, and Asma gives us a quick introduction into information needs and human-computer interaction. So I hand over to you, Gulraj, now, and yes, let us know if you have any questions. And Gulraj, you let me know when I click for you.
Thanks, Christiane. So to start, I just thought we could do something a bit interactive and have everyone either unmute themselves or type in the chat and talk about what they think design is. So it doesn't have to be a formal definition, just when we say design, what comes to your mind? Okay, I can see Ying, she said layout, there's fashion, creating something, planning, creating something, or a process. Good answer, Jonathan. So as you can see, design is quite broad and it brings different things to mind. So what we're going to go through now is a few examples of design gone wrong. One popular example is when WhatsApp introduced their delete message feature, which if you've ever sent an angry text or a text full of typos, everyone was very excited by. But when you actually got the feature, you get these messages after you've deleted the message. So it doesn't actually just scrub it. Someone will see that you sent something and then deleted it, which wasn't exactly what it was advertised as. And users are quite unhappy and gave a lot of feedback as to how this wasn't a feature that they wanted. Next slide, please. So let Asma go through the next couple of examples.
Yeah, thank you, Gulraj. So as you can see, it was not clear what do the arrows describe. Does it describe the buttons beside or above them? And yeah, you could imagine if you're in Rush and you wanted to take the elevator, how this would look like. Next, please. Yeah, and in this other example, at first when I saw the picture, I was confused. Is that a place that's meant to be for sitting, or is it for something else? And people who commented on this design were also wondering if the designer had a bad day or lacked social skills, but they all seem to agree that there is clearly something going wrong. Next, please.
So what we'll do next is just look at some of the different terms that are used when we talk about human-centered design and user experience. So these are some of the terms that we'll go over today: human-centered design, user experience, usability, user interface, user-centered design, and human-computer interaction. And there's a disclaimer at the bottom just to say, and this will come up multiple times in the presentation, that these terms are used interchangeably in the literature. The terms are defined differently depending on who's talking about them. So in essence, it just gets very confusing. So if they sound similar or you're unclear where there are differences, that's perfectly fine. That's how it's meant to be. Next slide, please. So I'll let Asma go over human-computer interaction.
So the human-computer interaction is the multidisciplinary field because it covers and relies on a wide range of topics, and such as computer science, behavioral science, cognitive science, psychology, and even design principles and many other topics. It looks at the interaction or relationship between human and computer systems. As you can see, human-computer interaction includes three parts: the users, or human, which can be a person, a group of individuals working together, a local community, or any particular population. And here, what plays a very important role is that the users have differences. So understanding the user are different. They learn in different ways based on their skills and capacities. They may have also cultural and national differences. And those differences are to be considered when you're thinking about the interaction between the human and the computer system. The second part is the computer systems. And here I'm referring to, or when you're saying computer system, it's referring to any kinds of technology. And so it might be a desktop computer, as you can see in the picture, but it doesn't have to be. So it could be a mobile app or website page if you're looking at this kind of technology. The final part here is more considered with how humans interact with computers and how computer systems are developed to interact with the humans. Of course, the difference between machines or technology and a human is understandable. However, both are meant to interact with each other effectively to ensure a successful interaction. Therefore, the human-computer discipline focuses on design, implementation, and evaluation of the human-computer interactive system, which makes it a very important discipline to develop functional systems that are usable, safe, and efficient for the end users. Next, please. So a simple example on human-computer interaction is similar to the one that you can see in your left-hand side. It's when you're basically pressing the power button to turn on and off the machine or technology. A more complex interaction can be seen in the virtual reality technology that involves an advanced components, such as machine learning, sensory input for speech recognition, voice control, behavior recognition, and even mood and emotional recognition. That overall makes up a very complex interaction.
So I'll go over the definitions of user-centered design and human-centered design now. Next slide, please. So user-centered design focuses on the users as sources of innovation. So people can develop insights or innovations by asking about the needs of the user or observing the users with existing products and tracking their behavior over time. Next slide, please. Human-centered design is defined as making systems interactive and more usable. So it focuses on the use of the system by people. It applies human factors, ergonomics, and usability knowledge and techniques. And Don Norman, who's popular in the HCD field, has defined HCD as a collaborative process where you put people at the center and you design around their needs, capabilities, and behaviors. So you focus on people as they are at the moment and design for them, rather than focusing on an ideal version of a human and designing for that idealized version of someone. So what is human-centered design? As we've seen in the previous definitions, it has to start with the customer or the person, and ideally you want to get in the middle of these three circles. So with desirability, it's what do people want? And here you can go a bit nuts and come up with far-fetched ideas. No idea is a bad idea. You can brainstorm as much as you want, but then at a certain point, you do have to look at the viability and feasibility. So viability is what's financially viable, A, for the customers, or B, for you as a company. If you're creating a product, you need to make sure that it's sustainable and that it makes sense. And then you have to look at feasibility. So what is technically and organizationally feasible? So some of the far-fetched ideas we might not have the technology for just yet. So as great as they sound, they're not something that you can create at the moment. So you want something that's in the middle of those three circles, that is what people want, it's financially viable, and it's technically and organizationally feasible. So these are the different phases that are involved in human-centered design, and I'll just briefly go over them. The diagram at the bottom is to show that human-centered design isn't like a funnel. You don't go from having lots of ideas and winnowing them down into having just one or two at the end. You have this divergence and convergence. So when you diverge is where you get more ideas in, as many as you can, and then you narrow it down, and then you diverge again to get more ideas, and you converge again. So you have this consistent broadening and narrowing during human-centered design. So the first phase in HCD is inspiration. So here you want to get a deep understanding of the people you're building a solution for. So empathy is really key in this stage. You want to define your design challenge. So you want to really look at the issue that needs to be solved. You then want to set a plan for your research methods, which could be which are usually like qualitative methods, but you can also use surveys in this. You then set a plan for your research methods. And as you conduct your research, you make sure that you're constantly taking notes on what you're learning and discovering. Then during ideation, you want to translate those learnings from the previous phase into themes. So that's similar to qualitative analysis. You then convert those themes into short insight statements. So that's just a simple sentence stating what you found. You then convert those into how might we questions. So that's a popular way of phrasing questions to generate creativity. So instead of just asking a question, you started with how might we, and then ask your question. You convert those how might we's into your ideas and then create a concept. From there, you go into prototyping. So your prototypes at this stage should be basic. So that's, using pen and paper, using PowerPoints to demonstrate what a website interface will look like. The lower budget, the lower time involvement in that, the better that it is. After your prototypes, you'll get feedback from your customers or people on how the product works, and then you'll iterate. So design is all about running in cycles. Once you've created a product that people are happy with, you don't just leave it there. There's always room for improvement and making things better. In the third and final stage, there's implementation. So that's where you test and introduce your solution to the real world. So you want to pick a target group. Who exactly do you want to test your solution on? You make a plan of action. So how are you going to approach these people? Are you going to do it in a real world setting? What's that setting going to look like? Then you actually launch your solution, and then you continue iterating and getting feedback. Eventually, from this stage, you can then scale up your solution. So in the next couple of slides, I'll just talk about global health and human-centered design and how they interact. So human-centered design can be used to directly or indirectly improve health outcomes. So the direct version is designing a health system, or the indirect version could be improving the management or organizational issues within the system. One size does not fit all in human-centered design. So if something has been implemented in a similar setting, you can't just copy paste it into your new setting. You really need to take into account context when you're designing. It's also important to rephrase human error and poor adoption. So instead of looking at it as flaws within people, you should look at those as design issues and something wrong with your product. Making that rephrase makes people feel heard instead of forcing them to adopt systems that they're unhappy with in the first place. You need to also then develop a deep understanding of who you're designing for in the context, and you also need to think holistically. So one of the papers talked about Paul Farmer and his work in Haiti. So Paul Farmer was interested in social determinants of health and how poor people have worse outcomes and are often not involved in system redesign. So during his work, he noticed that people would sleep outside the hospital for days, and no one would really ask them what they're eating or what their family eats while they're at the hospital waiting for care. So he said there's a need to design a better health delivery system by talking to people and asking them what would make this service better for you. There are some challenges combining global health and human-centered design. So as I've mentioned already, groups don't always use the same design terms or conceptualize the terms in the same way. So when you're looking for literature, it gets very confusing when people are using terms like co-design interchangeably with other terms, and they're using various levels of participation when talking about co-design. There's often a lot of information that can be found in the grey literature, but the scoping review, which is referenced at the bottom, found that the grey literature often doesn't go into enough detail for extraction for a scoping review or replication of the study in a new context. They also found that few papers described a full project cycle of HCD, and few studies actually evaluated the design project once it was implemented. Most of the studies also didn't talk about the socio-institutional dynamics of human-centered design. So that includes the design team's background, and often there weren't any designers actually on the team, the involvement or relationship to the context or the users. So they don't really look at those dynamics. Reflexivity doesn't come into the papers as much as it might do in qualitative papers, and they don't kind of take into account the insider-outsider perspective. So if your team has a doctor on it and you're working in a hospital, you'll have different access and different relationships with the healthcare workers there than if you were someone who doesn't have that medical background. But that isn't really examined in these papers. The other challenge that they found is that often the work ends up adapting the systems that already exist rather than reimagining and designing new systems. So if you get people who've worked in the system for decades, so let's say a nurse who's worked for 20 years in a hospital, and you ask them to do design work, it's often difficult to get them to completely reimagine how they've done their work because they've done it a certain way for a long time and can think of how the current processes can be better, but it's difficult for them to think of a completely new way of doing things that they've already done.
Thank you, Gulraj. So I take over and I'm going to give an introduction to user experience, which is also many times referred to UX. And we look at how it has an impact on healthcare and why we should use the concepts and principles in health systems research or health research in general. So I would like to start with this very famous picture that you probably have seen at some point. And it was created to explain a bit about what user experience is or means. And I would like to start asking you what you think user experience is, or what it is looked at, what it looks at. So please use the Teams chat box again and let me know what you think user experience is. How users interact with the system. How intuitive the design is for the people that use it and how useful it is for them. Very well. Maybe try to think about what you see when you look at the path on the left side versus the path, how it has been designed. Yep, the way that people use a system or product, the desired path. Yep. How users use a system, not necessarily how it's intended exactly. Users create their own ways. Users feel very well. So yeah, it's obviously about human behavior and a user's journey, but it's also about design and how designs have been implemented. And so doing my literature search, I came across a very interesting answer to the question what user experience is. And the simple answer was lazy or laziness. And that is because users want to pay the minimum cost to meet their needs. But yeah, let's have a look and go into details what it really is. So the International Organization of Standardization defines user experience as a person's perceptions and responses that result from the use or anticipated use of a product, system, or service. And so even though human-centered design and user experience have a lot in common, they are not necessarily the same thing. Both involve researching the needs of users and working with them to design and test solutions. And they each offer an alternative to traditional system-centric development that over time has been proven not to be very effective. But most importantly, both define and solve problems from the perspective of the people who receive services or use products, putting those people's wants and needs at the center of the development. So user experience can be seen as kind of a subset or area of human-centered design that refers to a person's emotions and attitudes about using a particular product, device, system, or service. And so while I continue in my presentation using the term product, please keep in mind I will refer to all of these terms. It can be either product, device, service, or system. Don Norman, who is not only the inventor of the term user experience, but also published one of the cornerstone books that Gulraj also referred to, The Design of Everyday Things, talking about user experience and design thinking. So his definition in this book is that user experience covers all aspects of a person's experience with the system, including industrial design graphics, the interface, the physical interaction, and the manual. So he talks about graphics and interfaces, and I am going to present to you and tell you in a second how this is linked to other concepts and terms, and therefore can be a bit confusing. So again, I have to bring in the disclaimer by Gulraj at the beginning of our presentation. There are many terms used interchangeably in the literature, and we have to be careful not to get confused. But I try to do my best to bring more clarity into what the literature says about user experience specifically, and how that is different to user interface and what usability means. So even though usability and user interface design are important aspects of user experience, they are again a subset of user experience. So let's have a closer look at user experience and user interface first, before we move on to the usability. A user experience designer is typically concerned with the entire process of acquiring and integrating a product, including aspects of branding, design, usability, and functions. So it is a story that begins before the product or device is even in the user's hand. And one could think now, this sounds a little bit like human-computer, human-centered design, but to differentiate those two again, human-centered design is more like the broader process, and user experience is kind of the subset or concept. So user experience, as the term already describes, is about understanding the overall experience or the entire journey of a person as they interact with every aspect of a product, device, or service, meaning from start to finish of using it. So UX design attempts to answer the question, how can I help people to achieve their goals in the most effortless way possible? And for that, for example, the functions and pathways of an app is a really good example, how a user can click through to get information, so the wireframes of a website or an app. User interface, on the other hand, is about using typography, images, and other visual design elements to turn a basic interface into something a little bit more digestible or more usable. So like the term user interface already describes, it is more about the process of transforming the wireframes into more like a polished graphical interface. And both helps with a product's usability, and we will learn about that in a bit. And so by polishing the interface, this creates kind of an emotional connection between the end user and the product to make it more desirable. So user experience is therefore made up of many interfaces, user interfaces, which come together in a hopefully seamless flow to form a product or device. But the limits of the user interface can be defined in a very simple way, as its focus in comparison to user experience is in the name, it's the interfaces. So the overall effect of a sequence of interfaces and all the less tangible parts of a product beyond that then make up the overall user experience. But user interface is purely concerned or focused with the visual elements that a person uses to interact with the product on his or her journey. And again, a good example is the typography, colors, buttons, or icons design of an app. So in other words, user experience design is concerned with the overall user friendliness of an entire user journey. And because user experience has such a rich history, there's also, of course, some debate over where it starts and where it ends. And because user experience as a category is not necessarily tied to a website, I think Apple stores can be a really good example for that. So Steve Jobs famously included the experience of going to an Apple store as part of the user experience of his Apple products. So not only the Apple product itself, but even the location where you can buy it had to be perfect and well perceived by the user. So how you buy a product, how you first see it, this can also all be important to user experience. However, both user experience and user interface require to research the user. And this can conduct user testing and usability. And so, yeah, what is usability then? Usability, if we look into the ISO definition, is defined as, and can answer the question, can the user accomplish the goal with effectiveness, efficiency, and satisfaction in a specified context when using a system, product, or a service, and it is taking into account the usefulness. So whether a product is useful requires then two components. The utility, meaning the product meets the actual needs of a user, and the usability, meaning it can be easily and successfully used. So this can, but doesn't have to, take into account different graphics or designs of a product, and therefore is also an important part for designing the interface, obviously. But again, usability asks, can the user accomplish the goal with effectiveness, efficiency, and satisfaction in a specified context of use? And user experience, on the other hand, answers, layered on top of this, did the user have a delightful an experience as possible doing so? So this includes whether the user likes the way it looks or feels, so the desirability or preferences and the overall feeling when it comes to the product, system, or service. And many people are using these terms. Many people who use these terms don't know sometimes, even when they evaluate the user experience, that part of it is actually usability of the product, which might also be the reason why sometimes the terms are used interchangeably. But the emerging trend in the literature is, and user experience designers tend to refer to user experience as the wider perspective, and something is usable because whether it looks good or bad, so one may think that user experience doesn't necessarily imply something is usable, because whether it looks good or bad, it's still an experience, and therefore usability is superior to user experience. But usability looks mainly at how a tool or product can be improved in terms of efficiency, effectiveness, and satisfaction. So let's look at the 7 factors that influence the user experience. There are plenty of diagrams that present user experience principles and can be used as kind of a checklist to ensure it is being done well. And I would like to present the honeycomb model by Peter Morwell, who is a designer and information architect who has been working in the field since '94 and designed for Google. And despite its age, I think he designed the honeycomb in 2004. It is still very relevant, and a classic user experience outlining the 7 essential aspects of user experience. However, he started working with the 3 circles diagram on the far left side first, showing the connection between goals and context, user needs and behavior, and content, to explain that there needs to be a balance between all of them. But quickly he realized there are more factors that influence the balance between the 3. So with the honeycomb, he then defined all factors that influence user experience. The product or containing information of that product needs to be findable and easy to navigate. That means quickly find a solution, or the navigation makes sense. It should be designed so that even users with disability can have the same user experience as others. So it is accessible for everyone. The way how it is delivered needs to be simple and easy to use, so it's usable. For example, how many clicks you have to go through something. And the visual aesthetics need to be attractive and easy to translate, so it becomes desirable. And this might seem like it's all about the branding, but branding doesn't come from nowhere. So again, Apple, for example, isn't successful just because their products are aesthetically pleasing, but also branded for being very intuitive and of quality. Credibility then refers to the ability of the user to trust the product in terms of ethics, durability, and accuracy. It needs to be useful and fulfill a need. If the product or service is not useful or not fulfilling users' wants or needs, then there is no real purpose for the product itself. And a good example for that is for Spotify's personalized playlist, which is one of the reasons why people probably pay for it. And then finally, the product or service must deliver value to the user. Like all aspects of user experience, this is obviously dependent on the user. Some user groups will value desirability over accessibility and vice versa. An example could be if you think about your usual day and the items you use daily, all those items have value to you. A user would not use a product if they don't find any value in it. And each application will be different based on the balance between context, content, and users. So like any classic text, it's been argued over, but I think it's a great starting point. But I want to present one of the optimized tools by Caterina Carigiani. She optimized the diagram of the honeycomb and grouped the 7 factors based on how the user interacts with the product. So she added how the user uses, thinks, or feels when it comes to the product, to create a connection between all of these factors. So she rearranged them so that the relationship between the factors is highlighted, and she added the colors and labels to make the grouping clear. And by doing that, she added the questions that have to be considered. What do users think about how useful, valuable, credible a product or service is? How do people feel about how desirable and or credible it is? And when it comes to actually using the product, is it findable, accessible, and usable? So if we now want to design something or conduct user experience research on something that already has been designed to understand the user's experience, there are several steps to be considered. And Von Neumann, for example, once explained very well, a product is more than a product. It's a cohesive, integrated set of experience. And you have to think through all of the stages, from initial intentions through final reflections, from first usage to help services and maintenance, make all of them work together seamlessly. So the honeycomb model makes no claims with regards to the process or where to start, maybe because in fact, user experience research can be done at any point, and maybe sometimes also should be done at any point of the design cycle. And it contains different stages that could start, but doesn't have to start with doing the research and meet the user to understand who the user is. Second, then empathize and try to imagine and understand his or her position. In a third step, create a service or device so that it creates value and fulfills the other factors from the honeycomb. In a fourth step, you could then test it, for example, by doing a usability study. Based on that, and finally, based on that, develop the final design. And what it is important, it is recommended to stick to it before doing another round of evaluation, because you need to give the user a little bit of time to understand what this is all about and to learn and to see whether it's useful and adds to the needs, fulfills the needs of the user. So each project is different. So the stages are not always neatly and have to fit in to each other in that process. The end of one cycle is probably basically the beginning of the next. So it is an iterative process. But when conducting user experience research or designing something, it might be helpful to know where you are in the design process. Within each step, different methods can also be used to go through another cycle to discover, explore, test, and listen. So for example, user interviews can provide a good amount of information by probing users with the why questions, but to be able to ask good questions, you really need to know who your users or your user groups will be, even without the system. And the feature of the product or device you are researching, you need to know inside out, which can also be done with a survey to conduct a usability testing. And as you start to understand your users' needs or perceptions or behaviors in relation to the product, and you understand that better, that's when you also start to ask better questions. So I think it's only logic that the research process here is really iterative and goes in several loops. Yeah, and other methods can be used along the process cycle, as you can see in the blue text boxes. So coming to user experience in healthcare. Again, like human-centered design, user experience can directly or indirectly improve health outcomes. Healthcare is, as we know, or should know, an area where user experience is crucial. Patients need to be happy with their physicians and hospitals as a whole, and at the same time, medical staff needs to be happy with what and how they can do to provide care to a patient, or the society and the wider system, or what the wider system expects them to do in their profession. So user experience should be really always in mind when we are trying to improve health, whether this is linked to technologies or other products or interventions being implemented, or whether this is to shape health services or wider systems. But it is also very helpful to look at when conducting health research on all of these. So, for example, in my DPhil, I currently assess the usability as part of a user experience, user interface assessment, evaluating audit and feedback tools and dashboards with the aim to improve quality of care for newborns. Anyway, I think it is no secret that how the healthcare industry is being really slow in adopting information technologies. And so the Nuffield research stated that healthcare, in comparison to other industries, is at least 10 years behind in digitizing processes. So with all of that delay in technology advancement, where user experience is really crucial, user experience then would be even more behind, because sadly, developers sometimes just didn't pay enough attention to the user experience along the way. This is a picture I came across when looking for user experience in healthcare and what can go wrong. And I found this rather peculiar example of what can go wrong on the right side. Why the designers of these red lines leading to other hospital departments, they might have seen this as they actually might have seen this as like a playful or fun experience, but most of those who played video games or watched zombie movies may see something completely different, like plot trails leading through a children's hospital, which is a bit questionable to design that. One of the more serious problems for doctors, though, is that they are used to have a large amount of paperwork besides providing care to patients. They have to dedicate an enormous amount of time just to write down the symptoms, diagnosis, prescriptions, and other things. So it's not a surprise that, doctors' handwritings have become a meme on the left side. And so ideally, there were new information technologies brought in and designed to support health services. And sadly, I think it's also no secret the NHS lost billions through the efforts to create a paperless health information system, while the plan originally was to make the system not only better in use of information and the technology, but also to save billions. And partly that is because the patient record systems have been abandoned by the users. So it is a bit questionable how much attention has been paid on the user experience here. And this is a very old version, for example, of an electronic patient file that was supposed to make data collection easier, and it contains important information such as allergies. But as we can see, I'm not sure it's big enough on your screens, but as we can see, there are no allergies recorded, but that tiny red bottom on the top is supposed to give information that there actually is. So this tiny red button was supposed to be an alert system function helping to reduce medical errors, which is in many parts of the world still a leading cause of death. So it's very easy to overlook. And this a study by Grundgeiger, who I reference on the bottom, why and how to approach user experience in safety critical domains, highlights very precisely that the personal experience of users is even more important in a safety critical environment like healthcare and hospitals. And the evaluation of the user experience cannot only help to optimize the interaction with the technologies, but also contributes to the well-being of staff, for example, by reducing numbers of burnout if it's designed efficiently, or staff leaving the profession. But also improving safety, for example, by reducing medical errors when the information architecture is designed well with user experience principles so that the tool actually works. So I would like to come to the question, who is the primary and secondary user? And start with an example. Let's consider a hospital setting and imagine a physician is in a ward checking on his or her patients with a paper chart on which to note any progress or patient information. And at each bed, the physician interviews and examines the patient and then makes an entry. Who is the primary and who is the secondary user in that interaction? Here the physician is the primary user as she uses the device, and the patient is the secondary user interacting with the physician while the physician makes entries. And the term primary user describes someone who interacts with the system. So the primary user is in direct contact with the system interface, and therefore is usually most affected by it. So when designing any system or interface, user experience professionals should keep in mind the needs and tasks of the primary user. But the secondary user, even though he does not directly interact with the user interface of, let's say, an app or like an electronic device, but he can still be affected by it. So the roles can also change if we were about to ask who is the primary user then in that context for the health services. So the primary user, for example, for an electronic device to collect data might be the physician, and the secondary user is the patient. While if you see it from the other angle of the patient, he's using the service, so he's basically the primary user if you look at it from this angle. So although almost all systems are designed with the primary user in mind, the fact is that the secondary user is also affected by it. And a study from the Norwegian University of Science and Technology looked at, for example, at handheld mobile devices in a hospital environment with mock patients. So physicians conducted rounds using different modes of recording devices, and then the physicians and the patients were both interviewed about their experiences. So they wanted to learn how each device affects the primary user and the secondary user. And so they found that when physicians used handheld mobile devices to make their entries and to keep a record, their user experience were better than with any other methods to collect data. They appreciated that any data entry could easily be made on site, and the device were easy to carry. In comparison, when the physicians made records, for example, on a terminal placed file at the bedside, they did not like the fact that information could not be kept confidential, and they found it difficult, for example, to bend over and to write and make records. And then looking from the patient's angle, and in that context, the secondary user, that was completely different. So patients were more satisfied with when physicians used a device that was placed at patient's bedside. But they felt that if physicians used a handheld device, it occupied their hands, and as a result, the attention of the physician towards the patient was gone. That's how patients felt. And yes, they felt like the dialogue suffered a lot from the handheld device. So with this study, they could prove that any system or any device affects both the primary and the secondary user, even if, or rather because, the device has not been designed with the secondary user in mind as a target group. So you could now ask the question, what is good design? And I would like to quote Don Norman again, because I think he gives a very simple answer to the question what good design is. Good design is a lot harder to notice than poor design, simply because good design fits our needs so well that the design is invisible or not recognizable. So now we presented human-centered design, usability, user interface, and user experience design. And for all these concepts, you must have realized the user is really the center of attention. So I would like to hand over to Asma now, and she will explain a bit more about the user needs and preferences and how they can be assessed.
So before we start a brief introduction on our needs assessment, we must first understand what a need is. So can you please type in the chat what is meant by need, or how would you define a need? So what do we mean by needs? Something required. Any other thoughts? So it seems like everyone thinks that it's something required. So next, please. So if you have a look into the English dictionary definition, you'll find that needs mean a lack of something demanded necessarily, or a require something because it's necessarily or very important. So yeah, similar to what has been mentioned by Abdul. According to the medical dictionary, next please, the word next is defined as a gap in personal health state, so which would benefit from an appropriate and effective care interventions. John and his colleagues on their paper Development and Importance of Health Needs Assessment defined the needs in the healthcare context as the capacity to benefit. And they meant that if the health needs are well defined, a successful intervention should be made available to address those needs and enhance the provided health overall. So what's also important to know is how to distinguish between the needs and preferences or wants. And those words are used interchangeably. One way to think about it is to view the needs, as we have mentioned, as essentials and necessarily for survival, and the non-fulfillment of them can lead to adverse outcomes. Whereas the preference are viewed as a kind of desire or wishes that are not essential for survival and do not cause any adverse outcome apart from sometimes mental distress. Another way to think about it is by considering that the basic needs are shared between individuals and do not change over time, but preferences, on the other hand, may differ according to different individuals and change over time. So now for those who are interested to know more about how to distinguish needs from preferences in the healthcare context, I would highly recommend a book by Rababeh, which I've referred to at the end of this slide. The author in his book discussed and provided a very interesting example on how to distinguish needs from preferences and how this must also be placed within a contextual framework of a modern, industrialized, and wealthy society and healthcare. So one of the author's main arguments in this book was that the medical or health needs merge into the basic human needs. And a very simple example provided was that we as humans need a certain amount of water that are dependent on the climate. And it's not unreasonable to qualify this need by adding that the water should not be contaminated with any kind of pathogenic bacteria. By this, he clarified what he means by healthcare needs emerging from the basic human needs. So taking this example furthermore, I'd say if you had the chance to choose between sterilized, sparkling, and flavored water, then your choice is more likely to be a preference, as we've clarified here. So now we've clarified what we mean by needs and how to distinguish them from preferences and wants. Drawing on what has been mentioned by my colleagues previously, conducting a user need assessment is the first step of a design process, and it's a very important one. So where the user needs assessment is to distinguish, so the user need assessment, if we want first to define the user need assessment, is a systematic method of understanding and identifying unmet health needs for the users or a group of individuals or community or whatever population you're interested in to facilitate making changes or creating a new intervention to fulfill their unmet needs. So as you can see, conducting a user need assessment includes the three main phases: pre-assessment, assessment, and post-assessment. You might come across other sources or other resources outlining the process in more steps or even using different terminologies. But if you look closely into them, you'll find that they all involved in those three main steps. So just to briefly describe each phase. So the first one is the pre-assessment phase, where we are more concerned with understanding and identifying the issue, and then the population involved in this issue. We will be also exploring any existing information and major need areas. What we could do in the first phase is considering what type of methods or tools that you'll be using in your next phase, which is the assessment phase. So you would maybe decide to use interviews, observations, surveys, or even a mix between different methods to gather the data that you need. The second phase focuses more on the data gathering using appropriate methods and tools, which you'll be able to define from the first phase. However, you could always change the tool if you felt like you need another method to gather the data or would help you more to gather your data. It also includes the analysis of the data and summarizing the identified needs according to the priority. The final step here is the post-assessment, where a set of priorities are used to inform further decisions that feeds into the process of solution creation to fulfill the identified unmet needs. Like other parts of the design process, the user needs assessment is non-linear and can be very iterative. So you might find yourself sometimes moving forward and then backward again, or even go into several loops. So what we have presented so far is kind of leading me to talk very briefly about my current empirical work, which I'm conducting part of my DPhil research, where I'm looking at the experiences and needs of families, particularly the mothers of small and sick babies after their hospital discharge in Kenya. So what I'm trying to understand is what are the information needs for those families, and what do they need to know, and if what they need to know is available on the information tools that they have currently, such as the maternal child health booklet, which is used now in Kenya to record the antenatal, so the pregnancy information, postnatal, so after the delivery, and also some information on the child's health development and growth. But it's also designed to include a part where you'll find all the most of the information, I'd say, that help the mother and the families in general to take care of their babies. So I'm trying to understand if this kind of tool is really meeting the needs of the families or not. So it's just like a brief example on how you would think about information needs and how you'd also evaluate them. So I think that's it for me for the user need assessment. So next.
So we heard now a lot about human-centered design, user experience, and user needs, and we developed a case so we can apply and think about these different concepts a little bit more detailed in relation to health services and health systems.
So we'll start with a story about the mother. A young woman, Dina, goes to a facility to deliver her first baby. She's heard good things from her friends about the hospital and is confident with her choice to deliver at the facility. Her husband is unable to take her to the facility on the day of delivery, even though they had a clear birth plan. An ambulance would be too expensive, so her neighbor takes her to the facility instead. She arrives at the hospital and is unsure where to go because she's only been to the antenatal unit previously. She can't get anyone's attention as everyone is very busy. Eventually, she manages to ask a cleaner where to go and arrives at the labor ward. At the ward, she's asked about insurance and whether she's filled the appropriate forms, which are kept at the hospital reception. She's told that without the correct documents, they cannot provide care as they may get in trouble. Someone kindly provides her with a wheelchair and she manages to get the documents and fill them in. She then has to wait as she's told she's not dilated enough. Next slide, please. After 3 hours, she's taken into the labor ward. She's a little scared as she is alone, but confident that the delivery will be smooth. However, she starts to feel severe pain and has trouble pushing. A nurse tells her off for being a spoilt brat and says if she doesn't push, her baby will die. The baby is born with a cord around its neck, which caused birth asphyxia. Dina is finally reunited with her husband, who is not allowed into the ward during labor. A nurse tells Dina she needs to go to a different ward, but Dina is unable to walk. Luckily, her husband manages to help her, and they move to the new ward. They are both unsure what treatment is being given to the baby and why. The healthcare workers are not being responsive to their questions. Dina is really disappointed by her experience at the hospital and tells her friend, who is due to deliver soon, that she would never go to this hospital again.
So the other perspective is the nurse. A senior nurse, Alice, who has worked in the hospital for 25 years, has just finished her shift. She had to care for 20 newborns by herself overnight. She's about to go home to see her children before they go to school. but she's stopped and asked to stay to help a new admitted mother delivering her baby. Reluctantly, she agrees to stay. The mother is not pushing enough during labor, which is prolonging the labor and putting the baby at risk. This makes the nurse anxious, and she tries to encourage the mother to speed up the delivery and push harder as the baby is at risk. The baby is born with a cord around its neck, which caused birth asphyxia, exactly what the nurse was trying to avoid. She quickly assessed the mother, who seemed stable and strong, but then she is called for resuscitation of a small baby and tells the mother that she needs to go to a different ward. The mother tries to stop her to ask more questions about her baby, but she does not have time to respond and tells her to ask the nurse at the next ward. So our first question would be, which user should we focus on? And maybe for that, you can also use the chat box. And after that, I will send you the entire case and we have more questions. What do you think, which user should we focus on? The mother or the nurse?
So far, it seems like people are leaning towards the mother. Does anyone want to unmute and say why they've picked who they've picked?
I couldn't decide. I chose both because I think that we need to really look at both sides of the experience in order to understand what the needs are and how to be able to meet them.
Yes, thanks, Sebastian. I think it comes back to the primary and who's the primary and who's the secondary user and what the different needs or preferences are. So depending on what we look at and from which angle we look at and with what exactly the mother or the nurse is interacting, that might be the focus might be different for each device or service or whatever it is. So for example, one thing, the mother could be the primary user and the nurse could be the secondary and the other way around. So when it comes to designing something, you not only look at who is your target user and user group, but you also look at who interacts with it directly or indirectly.